Serious. Therapists. What is something people are afraid to tell you because they think it's weird, but that you've actually heard a lot of times before? Intrusive thoughts. Nearly everyone has thoughts about pushing the old lady onto the subway train, swerving into opposing traffic, or stabbing their loved one in the stomach while cooking dinner with them. Some folks, however, take these thoughts very serious that believe that they might act them out. It's called thought-action fusion. Most of us are able to brush them off, though. I have heard some variant of, "This is probably weird, but I feel if I am my true self around others then they won't like me," more times than I can count. As I explore the formative situations to this belief alongside my clients, it definitely pulls at my heartstrings. The amount of people I see who feel like they should be grieving a certain way and are afraid that they must not have loved someone, or must not have cared. People grieve in all sorts of ways. The 5 stages of grief are bullshit. I was consulting with another clinician who was seeing a couple whose daughter had died. The wife was convinced that the husband must not have cared about her because he wasn't grieving out loud. In reality, while she had been going to support groups and outwardly expressing, he had been continuing to work in a garden that him and his daughter had kept when she was alive, using that time to process and grieve as he did. Both were perfectly fine ways of grieving. However, it is expected that one's grief is more than the other. They both ended up working it out, however, he driving her and others to their weekly support group, her attempting to work in the garden with him on the condition that they didn't talk. Really sweet. To that same extent, the amount of people who are unaware of their own emotions and emotional process is astounding. So many people feel only angry or happy and worry something must be wrong with them otherwise. Normalizing feeling the whole gamut is just as important. Recognizing what we are feeling as well as what it feels like in our body when we are feeling is incredibly helpful for understanding how we process and feel. As a whole, how we treat emotions as a society is kinda rare. Thanks for coming to my TED Talk. I'd say a common one is believing that there's something innately, irreparably wrong with them that makes them unable to ever truly fit in. For a lot of people it's such a deeply ingrained belief that it can be extremely painful to acknowledge or express, regardless of the level of personal success in their lives. 2 topics come up with regularity: when someone discloses to me that they were ESA as a kid, and or when someone is experiencing suicidation. Both are something I hear from clients every single day, and so I don't find it weird at all. But when I have someone in front of me who's talking about it for the first time, I know it's important to validate the fact that even though I might be talking about this for like the 5th time that day, they have never talked about this ever, and are in need of gentle care to feel safe. That they do not know what they enjoy doing. Often they have people in their life, including therapists, say try to do something fun today or ask what do you like to do when you have free time. Many people I work with do not know what those are. Once I explain that I dislike these statements questions because they assume people should know the answer, and that many people don't, I can watch as they relax, take a deep breath, and say something to the effect of, "Oh my, that's so good to hear. I have no idea what I like to do." That's part of the problem. More often than not they feel like they should know and that everyone else their age has it figured out. They are embarrassed to say that they don't know when in fact not knowing is very common. I couldn't even try to count how many clients I've had this conversation with. A common one in the time I was a therapist was simply "I don't know." You'd be surprised how reluctant people are to admit that they don't know why they're feeling how they are. But that's exactly why I'm not a therapist anymore, sat there with me, so we can figure out why together. It always put me in mind of a line from America by Simon and Garfunkel. "Kathy, I'm lost," I said, though I knew she was sleeping. "I'm empty and aching and I don't know why." Psychologist here. Basically, anything having to do with sex. There's so much shame. Say sexual fantasies and fetishes. Erectile dysfunction. Infidelity. Becoming sexually assertive. I've been told that I have a good psychologist's face. I try not to have a strong reaction to normalize the discussion. With adolescents, they are extremely anxious to tell me if they've relapsed or aren't doing well. They cut one night or they were suicidal. They're having a lot of negative self-talk or panic attacks. They'll come in, pretending everything is okay. It's usually in the last 10-15 minutes that they'll say something. They'll reveal that they worried they'd let me down, that I'd be disappointed in them. It usually turns into a discussion about policing other people's feelings and tolerating emotions. I explain that I care about their well-being and it's my job to monitor my emotions and reactions, not their role. Clients become quite fearful of admitting that they weren't successful since the last time they had a session. This could include not succeeding in using a coping skill that they're learning about, or not being able to complete a homework assignment I gave them. Humans aren't robots, and therapy is a lot of work. That being said, I don't expect people to be perfect as they start to work on themselves in a positive way. It takes time to really commit to change, especially in relation to trauma or conflicted views that an individual holds. I feel as if the client doesn't want to let me down as their therapist, but these failure events are just as important to talk about as successful moments. That they don't like their family members, are angry, want to stop communication with their parents, etc. I work in a country which is more culturally collectivist, so not wanting anything to do with your parents makes you an asshole in the current cultural sense. We deal with this almost on a daily basis. There is deep and profound shame in this, and when we find that line of "oh, it might be that your parents are toxic to your mental well-being, trigger your trauma," many of my clients actually get visibly angry with me. Cultural psychology is so important, cause when I first moved here I had my American European hat on. Oh boy, did I need to adjust. Edit, I'm in Ukraine. Women often feel really ashamed when they tell me they are burned out on being a parent or that they never want to have kids. I wish all of them knew how common this thought is. Some of the most common ones have been visual and or auditory hallucinations and SUI thoughts. I usually hear "I don't want to be put in the hospital" or "I don't want you to think I'm crazy." Also, basically anything sexual. I'm not going to judge you for being into BDSM, fetishes, etc. Honestly, I've probably heard it before and I'm not here to judge you. Same goes with any non-consensual experiences, especially if we're working through trauma. Hidden sexual dreams and fantasies about family members. More common than people think, and often stays that way and doesn't really interfere in the person's close relationships unless they allow it. Many things we dream or think are unconscious and involuntary, and the root of such things is often nonsensical. I do a lot of trauma work. Many people who have experienced moles or sexual assault feel ashamed and confused because their bodies responded. Having an erection, lubrication, or even an orgasm does not mean you wanted the sexual contact, and it is still assault. Clients often hold a lot of shame and confusion about this. They wonder if it means they wanted it or if there is something wrong with them. It is a tough thing to work through because of this. Assault is assault. Sometimes human bodies respond to sexual touch even when we don't want that touch. Edited to say, wow. Thanks for the awards and likes. I hope that anyone reading this who is struggling with feeling weird about their actions to ape assault and wanted touch feels reassured. I also hope you find a good therapist or a good friend to talk to about this. It is one part of your life story, but it isn't the story of you. You get to craft the narrative of your life. Maybe this is a chapter in that story, but it is not the whole thing. Trauma is a thing we experience. It doesn't get to define who we are. Usually it's sex related. Shame about their desires or kinks is common. Gender questioning is another. Some people are ashamed of things they did in childhood or adolescence, haven't ever told anyone, and think the team will be horrified. We have heard everything. Everything. I'm always compassionate and always understand why we do the things we do. I've yet to have anyone bring something I can't get. OCD gets misunderstood a lot. It's not just having a clean house or liking things to be organized. Common intrusive thoughts can include violent thoughts of harming children and other loved ones, intrusive thoughts of mole children, fear of being a serial killer, etc. My clients can feel a lot of shame when discussing the thoughts or worry I will hospitalize them. Edit. Thanks for the awards, kind internet strangers. Here are a couple quick resources for people who have or think they may have OCD. International OCD Foundation website www.iarcdf.org. The book Freedom from OCD by Jonathan Grayson. The YouTube channel OCD3. The app NOCD. I work with a lot of anxiety and trauma clients. Whenever I ask if they would describe their experience as being anxious about being anxious, I get a lot of OMG. Yes, anxiety has such a physical impact in the body. Heart pounding, trouble breathing, feeling faint or cold, tunnel vision, that we become aware of our body's reaction before we even notice the anxious thoughts triggering the reaction. Then we panic about why our bodies are flipping out when we're not even aware of feeling threatened, and the anxiety compounds on itself. Anxiety is like an alarm system in our bodies to signal the presence of, real or perceived, danger. What would you do if your alarm was going off at your house? Check to see if there's a real threat. Scan your environment situation to ground yourself in the present. Turn off the alarm. Breathing exercises do help, along with mindfulness techniques like body scans. And then investigate what tripped the alarm. Process thoughts around the situation that read like danger to you. It's also important to note that danger doesn't need to be a gun getting pulled on you. Panicking during a presentation that could impact your job and threaten the way you pay your bills and afford your life can feel pretty dangerous if you think about it. Edit. I'm an anxious person myself, and I respond really well to knowing more about an issue. If you're interested, look into polyvagal theory. It goes into great detail around the mind-body response when it comes to anxiety and trauma. Here's a YouTube video that talks about it in kind of a laid-back, TED Talk meets comic at a bar kind of way. As someone in the substance abuse field, I know that it's difficult for clients to tell me they got high with a parent, but it's something I get told fairly regularly. It's kinda sad that they haven't had sex with their partner in years and don't know how if they will ever have sex with their partner again. There is so much shame around sex in the USA that a lot of people are scared to talk to their partner about their sexual needs. Time goes by, and suddenly they haven't had sex in 3, 5, 10 years. It starts for a lot of people in their 40s and 50s. A lot of people, falsely, believe there is something wrong with their marriage because they fantasize about people other than their partner. I work in an older adult service for people with dementia and mental health problems. I see a lot of family members, carers feeling ashamed of the fact that they are finding it incredibly difficult to care for someone that has dementia or a chronic mental health problem. Carer burnout is a real issue, and people need to know that it's not easy to see someone you love struggling every day, or slowly fading away month by month. Carers and family members desperately need time for themselves and need to know that it's okay to feel the way that they do. No one is superhuman and we all have our own needs. It's why we have therapy groups for carers. It's okay to struggle to look after someone, and you should in no way feel ashamed of having those feelings. Edit. I am overwhelmed, in the best way, by all the people sharing their stories and relating to this. You are all amazing, and I'm sorry I can't reply to all of your comments. Stay blessed. That they hear voices. I've found that a lot of people aren't familiar with their own internal dialogue or self-talk, and that this is typically normal internal processing. A lot of people think that they are hearing voices and hallucinating. There are some pretty simple questions we can ask to determine if it's hallucinating or just internal dialogue, and most often it's the latter. Edit. I want to clarify that not everyone has an internal voice. Some have none at all. Some have more of a system of thoughts that aren't verbal, feelings, or images. That's normal too. I'm support worker, social worker, not a therapist. I've had clients too scared to tell me their accomplishments because they think they should only be bringing their problems to case management, and that if we see them getting better that we won't prioritize them as much. Another is hard drugs. We don't endorse it by any means, but we have to know if we need to keep an eye out for inappropriate behavior and overdoses. We never get mad at them for being high, we just wanna send them to their room to sober up. I'm beginning to focus on the people experiencing prolonged grief. It's kinda cute when people come in and say, I'm ashamed to admit that I still cry every day 5 years after my mom's death. That's why you're here, to seek support for your grief. Then there's anything and everything related to sex. I had a patient who contracted a serious STD and didn't tell me for 2 months because they thought I'd be grossed out. Edit. Some people are taking issue with my use of the word cute. I'm not saying their grieving is cute, but the embarrassment. It's cute in the way watching a child learn a new skill is cute. The patient is learning how to grieve, and the way one fumbles through that exploration can be rather endearing. Speaking to their departed loved ones. Thankfully, therapists now support this and don't consider it to be a sign they are not moving on with their lives. I encourage my clients to explore the continuation of their relationships with the deceased. Small ways they've made progress in the week. I know this isn't technically weird, but my clients sometimes don't want to tell me this, either because they fear I'd turn round and say they don't need therapy anymore, or because I might find the progress I'm not worthy. Both of which are totally untrue. That they're having bizarre intrusive thoughts of hurting themselves, others, sexual fantasies and so on. As a therapist, I'm trained to appreciate the whole world that lies between thoughts and action, and all it really proves is that we have an imagination. It's highly unlikely I'll need to break confidentiality, and won't call the police immediately. Sex-related things in general. Eventually we'll talk about sex, and I'll see a weight lifted off their shoulders for how unfazed I am by their apparently weird sex life. Honestly, it's rarely that weird, and we all have kinks. Life is fruitful, there's no need to be ashamed. I used to work in a religiously conservative area of the country a few years back. It's routine to ask about sexuality during intake. The number of patients admitting to suffer from sex addiction was quite high. On further questioning, this usually meant masturbating once a week. Other ones I could name are intrusive thoughts, like suddenly thinking about turning the wheel into oncoming traffic, and fear of being crazy after experiencing a panic attack, or a mistaken belief psychological disorders are rare and must mean something is horribly wrong with someone's character. This happened only with men. They think that they're a monster and a weirdo for sexualizing someone, but that's what literally almost everyone does. Edit. Yes, it's mostly weird, but it happens a lot. But some of these men have mental disorders and I feel bad for them because they feel bad about themselves. I'll try my very best for this. I'm learning English. I'm an educative psychologist in a rural school of Latin. Here lots of people is ashamed or afraid with getting married. I mean to live with other people. No problem with teens over 20 yo, but there are older people saying I prefer to live alone instead living with my family. And when I say alone, I mean very alone. Over 10k people here where I am and I have just met less than 10 old people living with someone else. Not exactly an answer to this question, but something that I think is really important to this thread, is talking about how they feel about me. I do my best to check in regularly about how clients feel about me, how I'm doing as a therapist, whether they are getting what they need, etc. It's really important to know for the wellness of clients whether they are getting their needs met. Many people have difficulty directly saying how they feel about another person for fear of making the other person, me, feel bad. It's important to be able to do this though, since it's how you learn to advocate for and manifest your own needs, which is in many cases the point of therapy. When I was in private practice, I specialized in borderline personality disorder. I did DBT, which is the evidence-based treatment for it, but there is so much shame and stigma around having BPD I have seen providers hesitate to diagnose it. My favorite sessions were the ones where I would talk about why and how people get BPD and seeing the relief on people's faces when a therapist can see that this is also something happening to them and that there is a type of therapy specifically designed to help. Those were my favorite sessions. And, to answer the question correctly, BPD is much more common than people think. It sounds vague, but just facing themselves. Their negative sides, acknowledging that whatever dark thoughts or perceptions of themselves seems to make them real. Not the case of course, because we are not our best or worst selves. But we explore those boundaries in our heads for sure. So many things. All very subjective, but mostly something that makes them feel like they are abnormal in some way. Creepy, unsuccessful, failures. Different things make people feel that way and it's always hard to admit. It takes a lot of courage to be open and honest in therapy, and I value that bravery and their risk taking every time. I have an interesting therapy experience. I'm a massage therapist. Muscles need therapy. I massage a lot of nurses, medical and educational for the most part. People release a lot once you calm their bodies down. A lot talk of burnout and giving up. A lot of people cry. It really feels good to help people like that. They say so much to me cause I'm quiet and just listen, I suspect. People don't really think massage therapy is a mental therapy, but I always have. Sex therapist here. Your fantasies are normal. No matter what you fantasize about, you're not the only one, and it's probably way more common than you realize. A huge part of my work is helping people normalize their sexuality and desires. Don't be afraid to talk about it, I've heard it all. Many of my clients live through severe childhood trauma and neglect. They had no one to model or explain healthy emotions or to show them appropriate ways to react to stress, fear, anger, etc. Most often they'll describe a completely normal reaction to a stressor and then follow that up with, "I don't know if that's normal." These are adults who were exposed to so much dysfunction during their formative years that they don't know whether it's normal to cry when they're anxious or afraid, feel angry when their boundaries have been violated, etc.